Hi everyone, welcome to Engear. My name is Ramya Subramani. Today we are going to see the importance of managing organizational change. Healthcare, it's a field defined by constant evolution, new technologies, shifting regulations and ever-changing patient needs. But change, while necessary, can be daunting. So, how do we effectively manage organizational change within this complex environment? Identifying the need and planning. We must clearly define the why. Is it a new electronic health record system, a shift to value based care, or a response to a pandemic? Articulating the need for change is crucial. Next comes meticulous planning. This involves a comprehensive assessment of the impact, identifying stakeholders, and developing a detailed roadmap. In healthcare, this means considering patient safety, data privacy, and the impact on clinical workflows. May need to involve physicians, nurses, administrators, and IT personnel from the start. A pilot program where feasible can help identify potential roadblocks and refine the implementation. So, how do we navigate these changes successfully? Firstly, communication is paramount. We need to be transparent about the reasons for the change, the expected benefits, and the potential challenges. Regular updates, open forums, and clear channels for feedback are essential. We must address concerns proactively and ensure everyone understands their role in the process. Secondly, invest in training and support. Change often requires new skills and knowledge. Providing comprehensive training and ongoing support can empower staff to adapt more effectively. This could include workshops, online resources, or even mentorship programs. Remember, people are more likely to embrace change when they feel equipped to handle it. Thirdly, foster a culture of collaboration and inclusivity. Change should not be implemented top down. Involve staff from all levels in planning and implementation process. Solicit their input, listen to their ideas, and address their concerns. This creates a sense of ownership and encourages by enforcefully celebrating small wins and provide positive reinforcement. Change can be a long and challenging process. Acknowledge and celebrate milestones along the way. Recognizing and rewarding staff for their efforts can boost morale and maintain momentum. Finally, lead by example. Leaders must demonstrate a commitment to the change and model the desired behaviors. This includes being adaptable, supportive, and open to feedback. Implementation, evaluation, and sustainability in healthcare. The stakes are high. Effective change management is not just about implementing new system on processes, but it's about improving the quality of care and ensuring the well-being of our patients and our staff. By focusing on communication, training, collaboration, recognition, and leadership, we can successfully navigate these complexities of our organization and create a more resilient and patient centered healthcare system. Thank you, and for more videos, stay tuned